This lecture will cover chapters 13 in Wheeler's regarding the roots and pulps of the permanent dentition. The pulp cavity of the permanent dentition has functions which are primarily formative. So the tissues in the dental pulp have odontoblasts that allow the tooth to lay down secondary dentin, reparative dentin, and form the pulp cavity throughout the life of the individual. There is nutritive cells, there are sensory cells, obviously with the case of toothaches and pain, and we used to think that the dental pulp only felt pain, but we now know that there are other sensations that it is capable of doing, but still dental pain is recorded as some of the worst that a human can experience in certain circumstances. And then it's defensive as well, so there are the immune system is obviously will work in the dental pulp as well. In this slide, we'll review the diagrams here of the pulp cavity, which, as you know, is the entire space occupied by the dental pulp, and primarily will involve the pulp chamber, which is that portion of the pulp that is occupied at the coronal aspect. And here we would have the pulp chamber of this molar tooth, and the root canal system, which is the rest of the root pulp that is occupied, that is within the tooth root. As you can see, the basic form of the pulp chamber is a basic outline of the external contours of the tooth. So it's pretty easy to visualize that information as to what the shape of the pulp is going to look like. As you're looking here in this proximal view, we can see that we have two horns, pulp horns in the pulp chamber as well. We have a roof, we have four walls, and in a bifurcated tooth, like such as a molar or a premolar, we may have what's called a pulpal floor. The opening to the root chamber, the root canals, are called orifice, and so those are the orifices there. There isn't really one in the anterior region. And then, of course, you have your root apex with the foramina. Apical foramen is where the tissue will exit the root. It's interesting, though, that the apical foramen is oftentimes not associated with the direct root apex and will come out at an angle or slightly shorter than the root apex. So in summary then, the pulp cavity follows the basic outline form of the dentin and follows the external form of the tooth. So if you understand the form of the crown, depending on which view you are seeing, you should be able to have a rough estimate, a rough idea of what the pulp cavity will look like. Odontoblasts, which are the formative portion of the dental pulp, continue to deposit dentin throughout the life of a vital tooth. So the early erupted tooth will have a much larger pulp chamber and much more pulp tissue than will an older person such as myself, who through trauma and other events, grinding, bruxing, dental restorations, the size of the dental pulp cavity decreases with age and traumatic events. So as I said earlier, the pulp chamber consists of the horns, pulp horns of the pulp cavity, or the pulp chamber has pulp horns, which correspond to the areas and locations of the cusps of the posterior tooth. You have a pulp chamber which has the roof, the floor, and four walls. And so if we were looking here at this premolar, you could say this would be the floor of the pulp chamber. This would be the roof of the pulp chamber, as you can see. And then you would have four walls, facial, lingual, mesiodistal. And it is of note that secondary dentin deposition is greater in the roof and the floor. So the odontoblasts that lay down secondary or repaired dentin, there are more of them in the roof and the floor than there are in the walls. And so as the pulp chamber recedes, it gets smaller, mostly in a, let's say, an apical to occlusal direction. And the walls, where we are doing root surface caries and those types of things, are actually do not lose that much space. So we would expect that there would be more secondary dentin in the roof and the floor than in the walls of the tooth. So the pulp chamber would still be fairly wide in your proximal or axial dimensions. In this slide, we'll review some terminology. Apical foramen is the opening near the root apex. So this is where the nerve of the tooth or the pulpal tissues will exit the root canal system. In many cases, this will be short of the actual radiographic root apex that you would see maybe on your patients. They may also come out in multiple canals, which is then called a delta system. So that's not uncommon to have not a single root apex or single root apical foramen, but there may be multiple smaller foramina that the delta system is what the pulp will exit the tooth. You have an apical constriction generally, which is a narrowing or a constriction in the root canal, and it's usually about 1/2 millimeter from the foramen. Dr. Lemon and the endodontic staff, Dr. Barboca, will probably talk to you a lot more about that when you have your endo class in the summer. But we tend to, when we do a root canal, we tend to want to file from about 1/2 millimeter from the actual foramen to make use of that apical constriction to help contain our filling materials or gutta percha. And we also need to be aware that a canal may demonstrate multiple supplementary or lateral canals, and I'll explain that a little bit more to you later. So while there are primary canals, if you look at the diagrams in Wheeler's and some of the things that we have now with the three-dimensional root form that we can follow through cone beam CT and those, you'll see the root system is very complex, and there may be multiple supplementary or lateral canals that are present in the tooth that you're treating. Again, returning to our line drawings of the maxillary anterior teeth, you can see that basically the central incisor will have 3 pulp horns, usually corresponding to the 3 facial lobes that you can see. The lateral incisor may have 2. The canine obviously would have 1 in this view. When we're talking about the apical delta system or accessory canals, sometimes those canals will come off at more acute angles down in the apex of the tooth. Lateral canals will more likely come out at 90-degree angles and are found more in the mid-root. Like we said, the delta system may actually extend and be multiple exits of the root pulp chamber rather than a single foramina, which you can see here. And then oftentimes the constriction that you'll see will be about 1/2 millimeter or so from where the actual foramina is. Pulp horns follow the crown form. Pulp chamber is widest in the cervical region, and that's true in the facial view or if we're looking at a proximal view. So looking at this proximal view of maxillary anteriors, again, we demonstrate a single root, mostly with a single canal that you can see, root canal. We'll also note that the widest portion of the pulp chamber is in the cervical area of the tooth. All very important things to notice. If you remember from your maxillary and mandibular anterior tooth lectures, that most maxillary and mandibular anterior teeth are single-rooted, with the exception of the mandibular canine, which has a fairly frequent example of having a buccal in a lingual root as well, or a labial in a lingual root. But in general, anterior teeth have a single root and a single canal, especially the maxillary anteriors. And if we look at cross sections of the maxillary anterior teeth, you can see that based on our basic form, remember these teeth are generally in the maxillary central and lateral, are wider mesiodistally than facial lingually, but we can see a fairly triangular root form in cross section here for the central incisor. And then we have an oval to round cross section at the cervix for the lateral incisors, maxillary lateral incisors. Again, a triangular root canal form or pulp chamber form at the CEJ for the central. Again, more rounded or oval in the lateral incisor, and then of course it gets more round as we go down further into the root structure. For the cuspids now, however, we start seeing the addition of root depressions on the mesial and distal in some cases. And so that makes almost like a kidney bean or a ribbon-shaped root, and I'll talk about that more when we talk about the mandibular incisors. So when we have root depressions, you can see here that they become little concavities that change the outline form of the pulp cavity and the root to more of a figure eight or even ribbon shaped in some instances. So as we look at these diagrams of the mandibular anterior teeth, you can see that the lack of lobe form in the crown actually corresponds to a lack of pulp horns and such in the pulp chamber as well. So most of these teeth will have one or maybe two pulp horns viewed in the facial dimension, and of course one viewed in the proximal depression. Again, the widest portion is still at the CEJ, and I will notice that I will try to remind you here that we can identify this diagram as mandibular incisors from a couple of different ways. First is, we'll remind you that if you remember, the CEJ on the lingual is about 1 millimeter or so below the height of the CEJ on the facial of mandibular incisors. You can also see the extreme curvature of the facial surface in relation to the long axis of the tooth, and the incisal edge being somewhat lingually positioned. You can also see that all of these mandibular anterior teeth at the cross section at the CEJ have ribbon-shaped roots. So these teeth are very, very broad in a facial lingual dimension and very narrow in a mesial-distal dimension. And they will always show some form of a proximal root depression and ribbon-shaped roots. That is going to be your primary identification of mandibular incisors versus maxillary incisors. You may have a mandibular incisor that's quite large from one patient on the tooth ID exam, and it could be about the same size as a small maxillary lateral incisor. But of course, the maxillary lateral incisor will not have proximal root depressions in it, so this is your dead giveaway that you've got a mandibular incisor in your hand or canine in your hand because of these proximal root depressions. Normally, we will have a single root. Normally, we will have a single root canal in these teeth, but they will be broad in a facial lingual dimension and narrow in a mesial-distal dimension. There is a fairly strong characteristic, and I'll show you in this next slide, of mandibular incisors being single-rooted but have two root canals, and I want you to really pay attention. So this is a slide that's going to save your patient and yourself some emergency care after hours of doing root canals on mandibular incisors. Please, please, please make sure that you see and prove it to yourself that your mandibular incisor does not have two canals. This happens with enough frequency that I'm going to ask you, if you're ever doing a root canal on a lower incisor, to prove to yourself that this secondary canal here, this either the root canal will split into a facial and a lingual canal, oftentimes in these incisors. And if you fail to recognize it, you will fail to remove the tissue and the patient will still be in quite a bit of pain. So keep that in mind. Most of the time these incisors will have a single root, but they may frequently have a split or a double root canal system. And then of course remember that the mandibular canine will be the one that's most frequent to actually then have two roots and a split root canal system as well. So if you remember, our mandibular canines, it's a fairly prominent frequency that they may have a facial or a labial root and a lingual root with corresponding root canals. Looking at the maxillary first and second premolars from the facial view, we can see a single pulp horn in the external portion of in the roof of the pulp chamber, single pulp horn. If we look at it from a proximal view, we will see two pulp horns. Generally, you'll have a buccal pulp horn and a lingual pulp horn. In the cross-sectional view, if we take the maxillary first premolar, remember the very striking anatomical feature of the mesial surface of the maxillary first premolar is this mesial concavity. It is a significant concavity that extends from the root into the crown form beyond the CEJ of the proximal surface on the mesial. This makes this tooth look almost kidney bean shaped in outline form. So if you think about that proximal root depression here being quite prominent, and it will make the tooth look kidney bean shaped. There is a high frequency of either one ribbon shaped canal in the root as we start down going apically into the root canal system, and or two canals, as you can see here further down in the root. Please remember that the maxillary first premolar about 50% of the time will have a bifurcated root. So this is depicted here in this diagram. So again, we would have a roof, a floor, and two pulp chambers, or two root canals as we see here. I've extracted first maxillary premolars that actually had three roots, much like a first molar. So don't be surprised by that if you see one that happens with enough frequency. That can be pretty prominent. Now the maxillary second premolar again shows two pulp horns at about the same height, because if you remember the pulp, the cusp height is about the same between the buccal and lingual cusp on the maxillary second premolar. It's about 1 millimeter or so shorter on the maxillary first premolar. The widest part of the pulp chamber again is in the pulp chamber, basically, near the CEJ. There will oftentimes be a single oblong-shaped root canal in this configuration. It may also be ribbon-shaped. It's not as frequent to have two canals in the maxillary second premolar as it is to have two canals in the maxillary first premolar. So again, if there are two canals, there will be a facial canal or a buccal canal and a lingual canal, which will be the prominent ones to do. Single pulp horns from the facial view, double pulp horns from the proximal view. Again, please pay attention to the mesial concavity that is present in the maxillary first premolar. Looking now at these diagrams of mandibular premolars, we will see we have a first and a second premolar. So from the facial view, we will see one pulp horn usually from the facial view on each of these premolars, first or second. If we look at a proximal view, which we see here in this diagram, the mandibular first premolar with the cuspal configuration that it has, and the lingual cusp being very small, will still show usually just one pulp horn under the main cusp, as you can see. The lingual pulp horn is not usually present as much. If we look at the second mandibular premolar, we will oftentimes see at least two or possibly 3 pulp horns under the crown when we think about a section either being facial lingual or mesiodistal. You will probably see 2 pulp horns in this view. The root form of mandibular first and second premolars are actually pretty consistent, being oval in shape, oval to round in shape. The corresponding root canal being similar, oval to round, so there's not a lot to talk about. There may be a slight furcation or a slight bifurcation in the apical third of the first premolar, but mostly it is a single root with a single root canal, which will be, of course, wider facial lingually than mesiodistally to follow the crown form. Let's review the anatomy of the maxillary molars, first and second. And if you remember that the maxillary first molar will have 3 roots, usually fairly broad spread, especially with the lingual root being extending out beyond the crown form of the tooth. Remember, the cusps will be either 4 or 5, depending on how many lobes the tooth has, so we can expect pulp horns that will equal the number of cusps that the tooth has. So there will be 4 or perhaps 5 pulp horns, usually 4, in the maxillary first and second premolar. The roots are not as broad on the second maxillary molar, so the root form will be closer together and more fused. Again, we have a furcation area that you can see, either a bifurcation or a trifurcation, depending on how fused the roots will be. We look at the cross-section of the tooth, we again see almost a triangular form, or at least like a quadrangular form for the pulp chamber, where you have a mesiobuccal root and a distal buccal root and a lingual root, which will be pretty prominent. So if you're looking down inside the pulp chamber like this and we see the orifices, this would be mesiobuccal, distal buccal, and lingual. Here is something to note: about 50% have a second canal in the mesiobuccal root. If that is, that would be a MB2 canal, meaning mesiobuccal 2 canal. And oftentimes then, if that canal is present, the orifice for it will be like right here in line with this. So you kind of think about making a rough triangle when you're making a prep to enter into the pulp chamber here on these maxillary molars. Again, not much difference between the second, although normally the second will not have this MB2 canal. So you'll see here a rounder, smaller mesiobuccal root, a rounder and smaller lingual root and root canal that you can see. And again, the distal buccal root will be smaller yet than the mesiobuccal, but again, single canal. So the root canal system of maxillary molars will have 3 primary canals or 4 primary root canals if the MB2 is present. And in general, you will see a single canal in each of the roots of the maxillary second premolar. Again, in terms of this diagram, for tooth identification purposes, the external form of the tooth, again, the maxillary first, very prominent roots, very divergent roots. The lingual root will extend out beyond the crown form generally. You can see that the lingual groove of the crown actually extends onto the root, and so if we look at the lingual root on the lingual or palatal surface, it will have a concavity on it, as illustrated in this diagram. The mesiobuccal root will be larger than the distal buccal root in both instances. The mesiobuccal root will probably have an MB2 canal in it, so it may have 2 canals in the mesiobuccal root of the maxillary first as compared to the second, which will generally have just a single canal. So lastly, we will discuss the mandibular molars, and as you can see, the number of pulp horns on mandibular molars will equal usually 5 in the first mandibular molar, so you'll see 3 on this facial section, and then there would be 2 more that you really can't see for the lingual root. On the mandibular second molar, we will see usually 4 pulp horns. Again, in the facial view 2, we have a mesial canal, or excuse me, a mesial pulp horn and a distal pulp horn. You will see 2 root canal systems. You'll have a root canal system for the mesial root with a bifurcation, and a distal root being a little more straighter, mesial root being a little more curved. Oftentimes, if we look here at the coronal cross sections of the first and second molars, you will see roughly quadrangle shaped pulp chamber, which would be, I guess, trapezoidal maybe. You'll see their pulp horns here, or the orifice would be one for the mesial buccal, one for the mesial lingual, as you see here, and then a fairly larger single canal for the lingual or the distal root that you see. So mesiobuccal canal, orifice, mesiolingual canal, orifice, and then distal canal orifice here, as you can see. The root, again, being bifurcated as we go down the root. You see a fairly large, broad root. You'll see both of these roots are wider in a buccolingual dimension than they are mesiodistally. The mesial root here on this first molar will have a very strong concavity. It'll be very thin in the center. And when you're doing root canals, you have to be very careful that you don't inadvertently cut through your canal system and into the periodontal ligament, because this tooth is very, very thin and fragile in that dimension. Here's a nice view of the first molar in the mesial root, showing bifurcated canals again. This is pretty typical. You'll have 2 canals in the mesial root and 1 canal in the distal in most of the cases. But this root is very, very, the tooth can be variable in that you can have also have 2 canals in the distal root, or you may even have 4 roots. So sometimes these roots will bifurcate in a buccolingual dimension as well, and you'll have 4 roots in place of just the 2 roots. So highly variable. Generally will be 2 root canals in the mesial root, 1 in ribbon-shaped canal or large canal in the distal. The second mandibular molar, same thing. Remember, this tooth will be a little more rectangular in shape when you look at it from the occlusal view, so you'll probably have a little more of a trapezoidal or rectangular shape to your pulp chamber when you look at it from an occlusal view. Again, mostly 2 roots, a mesial root and a distal root, mostly with 2 root canals in the mesial root and 1 fairly large oval in the distal root as well. Yeah, that's about it. Okay, hope you've enjoyed the lecture, and let me know if there's any questions, and we'll be happy to review them in class.